Hi everyone, this is Dr. Rajmohan from the Department of Public Health Dentistry. I am working as Associate Professor. So today's topic I am going to discuss both case history. It is most important topic because all the UGs as well as the PGs will go across case history because every practical exam will start up with the case history. Coming to the case history, it always start up with the definition. Usually the examiners will ask what is case history. So coming to the definition, that is planned professional conversation that enables the patient to communicate his feelings, fear, symptoms to the clinician so that the real or the suspected illness as well as the mental illness may be determined. So this is the definition of case history. What it explains is it may be a sensitivity or a pain. It can't be explained by the patient. So the clinician, you must know what is the real or with the suspected illness so that we can determine what is the. As you know, case history is a very vast topic and it is subdivided into 4 parts in my video. And coming to the first one, coming to the demographic data. As you know, what is demos? It tells about the patient characteristics such as name, age, sex, education, occupation, income. It all explains about the socio-economic status as well as the religion and also the marital status of the particular patient. Okay, let us start with the name. Why you should ask the name of the patient? Always because for the identification as well as for the communication, and also it will give a psychological benefit to the patient as well as you can build up a rapport, not mentioning like cases. It should start up with the prefix like baby, master, Mr. and Mrs. So it will be beneficial to build up a pakka rapport with that of a patient. So coming to the next one, that is age. Why you should ask the age? And start up with the, if you are going for the example, the patient age is 24. Don't mention it as 24 YRS. Write in the full form. Both for the UGs as well as for the PGs as in the examination point of view. Okay, why you should ask about the age of the patient? It serves 2 purposes. One is dosage, because you can't give a paracetamol 500 mg tablet for the adults as well as for the children. So age dosage formula. And the other one is the age related diseases. Okay, coming to the what is the age related diseases? So at birth, what are the most common diseases such as cleft lip palate? Because the examiners will be asking why you want to give some examples for the age related diseases. So at birth, it is cleft lip palate, microglazia and macroglazia and aenetia. At infancy stage, that is palatal cyst of the newborn as well as the dental lamina cyst of the newborn. Coming to the most common thing, that is for the children, it is rampant caries or the nursing bud caries. And coming to the adults, you may know that is dental caries and OSMF. It can occur in children as well in the adults. And coming to the older age, wasting diseases like attrition, abrasion, erosion, and also leukoplakia and periodontal disease can mostly occur in the older age. So coming to the next purpose, that is age dosage formula. There are various age dosage formulas like Clark's rule, Young's rule and Dilling's rule. Coming to the Young's rule, what is the formula for the Young's rule? As you can know, that is child's age by age plus 12 into adult dose. Coming to the Clark's rule, that is child age at the next birthday divided by 24 into adult dose. Coming to the last one, that is Dilling rule, age divided by 20 into adult dose. These are the various age dosage formulas by which the tablets or the medication which you are going to give to the particular patient can be determined. So this is the purpose for asking. Coming to the next demographic data, that is address. Why you are going to ask the address as well as the contact number of the particular patient? It is for the future correspondence as well as the communication. So why you want to know the address or the nativity of the patient? Because we all know what is endemic or the endemicity, the constant presence of a disease or agent in a particular location. Or as we all know the example for endemic, that is common one, that is dental or the skeletal type of fluorosis. Because as you know, fluorosis is an endemic disease. This is the main reason why we are going to ask about address or the nativity of the particular patient. Coming to the next demographic data, that is occupation. And why you need to ask about occupation? Because occupational diseases like if the patient is going to work in acid factories or something, battery acid factories like the wasting diseases like erosion can happen. Also, the persons who are working on an outside area, countryman's lip, that is the carcinoma of the lip, can occur. Also, we all know the notching of incisors is mainly due to having the bobby pins in between the incisors, that is like cobblers as well as for the tailors. It can happen. The happening is called as attrition in the tailors or the cobblers. Next, demography data, that is religion. Even the patient will be asking, why you are asking about my religion, sir? Because some diseases are pertaining to the some sort of religion characteristics. Like usually the Orthodox Jains during their fasting period, they will not be brushing their teeth. They think that the microorganisms which are present in the teeth can be hurt due to the brushing habit. So this is one of the characteristics for the Orthodox Jains. Also, we can come across a term called taboos, TABOO. What is that? It's a strong social prohibition or a ban against a word, action or offense. So, example is Muslims usually avoid eating what? That is pork. And Hindus are abstinence from eating beef. So, this is one of the taboos. So, this is also one of the characteristics why you are asking about religion. Also, Muslims usually they will be wearing purdah so that it can prevent basal cell carcinoma. So this is the reason why we are asking about religion. We are starting up with the socio-economic status of the particular patient. Before starting with the socio-economic status, what are the various factors you are going to assess for socio-economic status? That is education, occupation and income. So coming to the income category, you must ask an additional question, that is how many family members are there in their family. So that also who are the earning members in their family. So then you can go to the socio-economic status. There are various scales to assess the socio-economic status of the particular patient, like Pari scale, Prasad scale and finally Kuposami scale, which is again modified in the various years. Coming to the Prasad scale, it was originally given in the year 1961 and then it was modified in 1968 as well as in 1970. And finally it was modified again in the year 2004. And what it explains, it is based on per capita monthly income. So also in 2004 what they have included is below poverty line. And the next question which will be asked by your examiner is what is below poverty line. So the below poverty line explains that the minimum amount of money earned by a person in a country. For India it will be around 1,20,000 according to the present data which is obtained. So the coming to the next set of classification, that is given by Parikh. It will be based on 9 factors like caste, education, occupation again, and also it is mostly useful for the rural population. So the another important scale which is going to useful for the assessing the socio-economic status is what you are going to use in your examination purposes, Kuposami Scale. So Kuposami Scale was originally given in the year 1976 and it was again further modified according to the various income, family income categories according to the present per capita income of our India. So the last data which we have obtained is March 2020. So what are the various again factors which are included in the Kuposami Scale is education, occupation, income. And most of the income details you can see it in the background of the slide. So that is first we have go to education. There will be 7 criteria starting from 1, that is illiterate, and finally ending up with the professionals, that is in the score of 7. And coming to the occupation, again whether it will be unemployed starting with 1 and also it is ending up with the score of 10, that is including legislators and also managers. They are above professionals, so under the score of 10. So this comprises with education, occupation. Coming to the final one, that is family income. This is what I want to know, why, who are the family members and who are the earning family members. So coming to the total family income, according to the present per capita income condition of our country, that is India, it is around 1 lakh to the maximum criteria, that is from starting from 1 to 12. So the 12 will be around 1 lakh family income. So these are the various factors which we have been considering for Kuposami Scale, which is modified lastly in the year 2020. And usually for the PG level, you have to write the reference who gave the modified Kuposami Scale. So this comprises with the socio-economic status of the particular patient, because of which what you are going to do. Because of which what you are going to do. This is the question which will be raised by your examiner, and you should explain that, based on which I am going to decide a treatment plan for the particular patient, whether they can affordability or the particular patient can be explained due to this factor. So the coming to the next demographic data, that is type of housing. So again, this is one of the factor which is going to give an insight of the particular affordability of the patient as well as their occupational status. Coming to which, what are the various classification, that is Pakka house, semi-Pakka house, and finally Kacha house. What is the Pakka house? Usually two concepts are taken, that is one is the wall material as well as the roof material. And the wall material of a Pakka house will be made up of either with the concrete cement, and usually the wall material and the roof material will be made up of a RCC, that is reinforced cement concrete materials. Coming to the semi-Pakka house, either one of them, that is either wall or the roof material will be made of this material, that is the RCC based cement or asbestos sheet. And in a Kacha type of house, it will be the roof material will be made up of either bamboo sticks, thatches, or a loosely constructed stones. And also unburnt bricks will be used in Kacha type of houses. So this is another demography data which you have to look it in the case history point of view. And coming to the end up of demography data, I want to wind it up that name, age, sex, education, occupation, income, total number of family members, including the modified Kuposami Scale status, religion, and finally ending up with the type of housing. Coming to the next heading which you are going to assess is chief complaint. It will decide what you are going to do to the particular patient. Why and how you are going to ask the chief complaint. Usually it should not be motivated, that is there should not be any motivation behind the reason which the patient is giving, and you should be in the patient own words. And the next question which will be asked by your examiner is what is the necessity of asking in own words. So these are the following reasons, because there should not be any technical terms, because it may lead to misconception of the data which is provided by the patient. And the next one is the medico-legal cases, that is the medico-legal issues, and this is applicable only if you are going to get a written consent. Otherwise it is not going to be applicable in our country as of now. And coming to the next one, it should be based on needs, that is, and in the PG point of view, you will be again another cross question will be added. What are the various type of needs? Actually, Bradshaw classify the type of needs, that is felt needs, normative needs, express needs. Usually felt needs is a concept, that is what the patient feels. According to the definition which I have already told, the patient real or the suspected illness. That is why we are asking in the patient own words, that is felt needs. The patient, what he is thinking, it may be of a sensitivity or a pain, and what he thinks, that is felt needs. And normative needs, that is what the physician or the dentist you feel, whether it is a real or a suspected illness. This is normative needs. And finally express needs. Express needs is what for a particular population. For example, you can take if a place called Dharmaburi, where everyone will be knowing that the fluorosis is little bit higher than the normal. So for the particular population, what will be the expected needs, what we can do to avoid, or what is the treatment modalities available to treat our fluorosis stains. So this is express type of needs. So these are the various type of needs you need to know when examiner is going to ask. So these are the three reasons for which you are going to ask the chief complaint in the patient own words. Also it will give an insight or a clue to our final diagnosis.